Hi, it's Glen Macnow of WIP. I'm here with Dr. Koren of the Cooper Heart Institute, and today we are going to answer all of the great questions that were submitted through cbsphilly.com/CooperDocs on Heart Month. Dr. Koren, let's talk about some of the factors involved with heart disease. Many things play into it, and somebody asked a question about genetics, that both of my parents had heart issues at a young age. What concern should I have?
So heart issues that are common that people talk about genetics are blockages. That's the most common thing that people say, oh, I had heart disease, heart attack, people in the families had stents or bypass surgery or died suddenly from heart disease. That is clearly those patients, those people clearly have a genetic influence. And when both your parents, which is both your genes from your mother and father, both have heart disease, that puts you at a marked increased risk for coronary disease or heart disease. And those people should take it very seriously. The most important thing for these people is to not smoke. That's the most important thing for those people to control. And there are modifiable, what we call risk factors. So things that you can modify to reduce your risk for heart disease.
All right.
But I say to people, though, it's really important that I say to people, you can change your genes, but you can't change your genes. You can change your pants, but not your genes.
Okay.
So if you have genes, you got to take it seriously.
But not smoking, number one. Obviously, weight is a factor. Somebody specifically asks, is weight the number one factor? Well, is weight the number one factor?
I would say weight is a significant factor, but it's not the number one factor. I would say that weight contributes to hypertension, it contributes to cholesterol abnormalities and triglyceride abnormalities, increases your risk for diabetes, increases your risk for sleep apnea, for atrial fibrillation, things that we talked about. But I would still say that the number one risk factor is genetics. And if you go down the list, genetics, smoking, high cholesterol, hypertension, diabetes.
High cholesterol is the next one. Somebody says, I love eggs. Is the cholesterol from eggs bad for my heart?
It's a fascinating question because the traditional answer years ago was don't eat eggs. Never eat eggs. And what we're finding now is that the diet that's best for people to prevent heart disease is a low carbohydrate diet.
A low carbohydrate diet?
Correct.
So keep the eggs, lose the toast.
Correct. That's exactly right.
How about that?
And the butter.
And lose the butter.
Yes.
Okay, that is really different from everything we grew up with.
That is correct. So
you're not going to change your mind in 10 years, right?
No. I think this is pretty established.
Science?
Yeah, this is pretty good science. So we've come to understand that carbohydrate metabolism, that's your breads, your pastas, your ice creams, your desserts, all the things that we all love to eat, those are the things that are worst for you. And what we know is that the Mediterranean style diet or type diet, which is really high in protein, is the healthiest diet for your heart.
Wow, okay, so the commercial that I'm thinking of is the little boy who puts the Cheerios in his dad's pocket.
Right.
Cheerios going to help me?
Cheerios won't hurt you. It's probably a healthy snack when it comes to carbohydrates.
Does drinking alcohol in moderation every week affect the heart in a negative way? What are your thoughts on a beer a day, a glass of wine a day? Let's go with the beer. Does it have any positive or negative impact on my heart?
There's a lot of evidence that a glass of red wine a day with the flavonoids in the wine that has some antioxidant properties are beneficial to the heart.
This is your Mediterranean diet.
Correct. Beer, not as much evidence. Sorry, Glenn. But take out that question.
Not going to hurt you.
Yeah. No. So but moderation is a very subjective really answer because moderation to one is very different than moderation to another.
Well, you're the professional. What's moderation to you?
So if you have a glass of wine, red wine a day, that's beneficial. If you drink alcohol on a regular basis, more than 2 beers on a daily basis, that is probably not good for your heart.
Then you're officially a lush. Are men or women more prone to heart issues? How often should you get checked for heart issues? Should you just get a yearly physical? Does a yearly physical count and keep it in check? Let's start with the beginning. Dr. Koren, are men or women, either one, more prone to heart issues?
Contrary to popular belief, that's men and women are equally subjected to the risks of heart disease. So heart disease is the number one killer in women, as it is with men. People have this impression that heart disease is the number 2 killer in women because they think of cancer and breast cancer in particular. The truth of the matter is that heart disease is the number 1 killer in women. And so we can't ignore that, and women should not ignore that. What we're seeing, though, is that younger women seem to be more protected, and as they get older, they're less protected. So That's clearly the case. And make no mistake about the fact that women are at equal risk as men to develop heart disease.
Okay. So let's talk about some preventives. We talked about staying in shape, keep your weight good. I'm assuming getting a good amount of sleep is always helpful,
Correct.
as it would be for any health issue. But somebody asks, Dr. Koren, are any supplement suggestions for heart health to take on a daily basis? If so, what's a good age to start?
That's another good question because it comes up very frequently.
We got smart listeners. I
We
want
do.
you to know that.
I'm telling you.
Uh-huh.
They don't just know their sports; they know their heart
No,
disease.
they know everything. That's right.
Okay, so daily supplements. If you have a family history of heart disease, which goes back to an earlier question you had, taking a baby aspirin a day has been shown to reduce your risk of heart disease. So if you have a direct family member that had a heart attack, bypass surgery, stent, take a baby aspirin daily. Other than that, much of the supplements get a lot of press, but have limited true scientific benefit. We think that fish oils, and there's some evidence that taking 2 grams or 2 big tablets of fish oils daily reduce your incidence of heart attack.
That's good. I do that.
Yes. So there's some additional benefits for fish oils, not just your heart, but at the end of the day, we generally recommend as a prevention that. Coenzyme Q10 is getting a lot of press. If you read or listen to the advertisements, there's limited evidence. What we know.
Say that one again slowly.
Coenzyme Q10.
Okay.
Coenzyme Q10 is a supplement that's used very commonly, and people hear about how it's your heart health. The truth of the matter is that where we know it's beneficial is in patients that take statins, which is a treatment for high cholesterol. It seems to reduce some of the side effects from statins. So when people get muscle aches,
Yes.
right, from statins,
Yes.
they talk about that.
Yes.
If they would supplement their diet with coenzyme Q10,
Mhm.
there is additional
See
benefit.
how I'm writing this down?
Yeah, write it down. You
That's
never
good.
know.
Q10. There you go.
On the way to the gym.
Because I take statins. I am going to the gym from here, and I do take statins, and I do feel sometimes like
Like,
you get those. Yeah.
yeah, maybe
Okay.
beneficial.
Okay. So you take this in addition, not instead.
In addition, absolutely.
There you go. All right. Very important question, Dr. Koren. What are the symptoms to watch out for in a potential heart attack?
So the problem with the heart is that it doesn't have the same symptoms for everyone. Right? So if you break your bone, you break your wrist, everyone's going to get pain in their wrist. You're not going to get pain in your elbow, you're going to get pain in your wrist. And the problem with the heart is that it's heterogeneous. So everybody has symptoms differently. And what that means is some people may get jaw pain, some people may get arm pain, most people get chest pain, some abdominal pain, some people just may nauseous, cold sweat. It's really heterogeneous. What you have to really be thoughtful of is a real change in how you feel, something that's different for you, and take it seriously. And if you have a family history, don't ignore those types of symptoms, whether it's arm discomfort, chest discomfort, jaw discomfort, nausea that's unusual, cold sweating, lack of energy, unable to walk because you're short of breath, general feelings of malaise and fatigue. Those are things that you don't ignore.
Okay. Let's look at somebody actually asks a very specific question, kind of as a follow-up to that. It says, Doctor, I have a heart murmur. I've had one since I'm little. I've never had any complications with it. However, when I drink too much coffee, Red Bull, I'll stay away from that, or take Claritin D for my allergies, my heart pounds out of my chest for hours. Is there anything I can do to help calm this down? I'm reliant on the Claritin D for the allergies throughout the year.
So, a heart murmur, let's start with that. A heart murmur as a child may be a benign murmur, but if it stays through beyond childhood, it should not be ignored. He may have been born or she may have been born with an abnormal valve or a hole that needs to be evaluated by a cardiologist, by a qualified cardiologist. Typically, if you're under 18, by a pediatric cardiologist. If you're over 18, by an adult cardiologist. And a very simple test called an echo or an ultrasound of the heart is a very good screening test. And the second part of the question is really some homeopathic supplements that this person's taking, which is Claritin D for allergies,
Right.
which is over the counter, and Red Bull, which is obviously a recreational supplement. And those things there's some red flags with that, because Claritin D, the D portion is a decongestant, and in some people it makes their heart race and blood pressure go up. So first thing I would say to this person is try to take the D out of the Claritin and maybe take the Claritin without the D. And the second is, I'm not sure what you benefit from Red Bull. Maybe getting some good sleep and not partying too late would help this person who is taking supplemental Red Bull. But Red Bull is very high in stimulants, and they're over-the-counter stimulants, and I would suggest that the palpitations are related to some of these things that this person is doing.
Do you have an opinion on coffee? Too much, too little, enough? I noticed, Doc, full disclosure, you walked in with a nice cup from Dunkin' Donuts or wherever. Starbucks.
But the answer is coffee is the most maligned and studied drug or supplement that has ever been evaluated by lay press, by professionals. Coffee has never really been shown to be bad for you in and of itself. Now, coffee with high caffeine can certainly stimulate your heart rate and make your heart go faster. So in some people it will precipitate palpitations and the like. But coffee in and of itself, the coffee bean, has never been shown to be detrimental.
Okay. Let's wrap up with this one, Doc, and we've covered it along, but let's just kind of go back one more time to revisit preventive measures, lifestyle and preventive measures. Just kind of give me a checklist of the things that a smart thinking person should be doing.
So regular exercise, which is aerobic exercise at least 3 or 4 times a week, which really means rowing, biking, walking. 30 minutes of continuous exercise has been shown to be heart healthy. Fact.
How often a week?
3 to 4 times minimum.
Okay.
I mean, daily wouldn't hurt you, but the bottom line is that what's been shown to be beneficial is 30 minutes of continuous exercise, 30 to 40. That doesn't mean weightlifting, it's aerobic exercise.
Gotcha.
Second is if you have a strong family history, again, a baby aspirin daily. Keep your weight trim.
Well, I was good on the first 2. All right, we'll work on the third.
Keep your weight trim.
Okay.
Avoid unnecessary sleep loss. So many of us can't avoid it, depending on our jobs. If you have to be here at 6 in the morning to work, you got to get up early, as do I sometimes. But getting your regular sleep is definitely beneficial. Not smoking. That is clearly the number one thing. It's really turbo for your heart. I mean, it's turbo for heart disease.
Yeah.
I call it our annuity, which means that people continue to smoke, they're going to need cardiologists like me. The reality is if smoking goes away, it will definitely improve their risks.
Very good. And that's going to conclude it. I'm Glen Macnow with Dr. Koren from Cooper Heart Institute. To view this and our other webcasts with the great people at Cooper Health, go to cbsphilly.com/CooperDocs.